Healthwatch Wokingham invited John Redwood MP to come and discuss health and social care issues with members of the Wokingham community.
The first question came from Ribena. I have a child with profound learning needs who will be leaving secondary school this year and have found there are no suitable local provisions for him to either be cared for or go on to do social skill-based course. Who is responsible for making sure local authorities have suitable care and educational facilities for the special needs, and that they adhere to the rules and guidance set out in the Care Act?
Good morning, ladies and gentlemen. Most care is local, and this government, like previous governments, feels that the bulk of the work of organising and providing care you and your loved ones need should be a local authority matter. So the first answer to the question is your councillors are responsible. We elect 54 Wokingham Borough councillors for this and related areas. We have a Wokingham unitary authority, so they have the full range of responsibilities for social care and for housing and other related topics that may be important. And they receive substantial grant aid from the government, as well as collecting council tax and other monies to finance the services. So if you're finding that you're not getting the care and attention you think you need or deserve, your first protocol is to go to your local councillor, who will be your voice and representative, and you have the right through that councillor to take it to the executive of the council, who make the overall policy decisions about what care they provide, and you have the right through your councillor to go to the council if necessary, because we have a council with council debates where these matters can be highlighted and improved. Most care is delivered locally, but in the case of some specialist care, it may be that the best specialist care is somewhere else, and the council has the power to buy in care in other parts of the country. I was looking at a case at my surgery this morning about provision for a challenged young person who probably needs something other than the current range of services being provided by the local school and local social services, and there they were looking at a number of options which might include a boarding school outside the area of the council, and that is something that they are able to decide to do and to pay for if they see fit. And the same can be true for young people after they have passed the age of full-time education. There are various types of provision around the country, and if the individual qualifies, then that's something that can be arranged with the council. Best of all is obviously for you as a concerned adult to work with the officials at the council, because there will be named officials responsible for your case, but the council is there if it goes wrong. Nationally, we try and put in national audit and standards. So we put in the Care Quality Commission to investigate and to review the various facilities around the country that are used by local government to provide care, and so if there are issues on an individual place where someone you know is involved, then they can report direct to the Care Quality Commission privately and ask for that to be investigated. We have the Safeguarding Adults Board, which is another route for review of these matters. There is also the right to appeal through the council's formal independent appeal system. So you've got various routes for challenging malpractice or inadequate care, but my recommendation is to start with your named representative on the official side, and if that doesn't work, to use your councillor. I don't think people use their councillors enough, and I think councillors are normally very willing to help, and they have powers the MP doesn't have. As MP, I have certain rights and powers to deal with national officials and national government, but there are parallel rights for councillors that I don't have to demand information and to hold to account local officials.
Thank you very much. Okay, so the next set of questions, and I guess this is our most popular topic that we hear about within Healthwatch, is access to GPs and access to primary care. So I'll start off with a question from Peggy Priest regarding appointments and diagnosis by telephone system at the Wokingham Medical Centre. Would you support having an NHS drop-in the Wokingham area, as the surgeries are finding it hard to cope with more houses being built and the influx of people coming into the country. We can only expect so much from the doctors.
But what I want is good quality services, and I think that's what we are paying our taxes to achieve. And that's what the current government wants, and indeed I think it's what the previous Labour government wanted as well. And the issue is, are we getting all the money to the right places, and are we then managing to recruit and appoint the people that we need to provide the service you want? I don't have a strong view personally on whether we need a walking centre in addition to the GP surgeries. I'd be very interested to hear a wider range of opinions on that matter. I think walking centres can work quite well, and one of the advantages of a walking centre is it's more easily available at more hours of the day and on antisocial days in a way that the GP surgery isn't always. And as you'll be aware, this government is very keen to create a 7-day-a-week NHS, and that is proving a little problematic, as you will see. And I think the government is well-intentioned. I don't always think the government is well-intentioned, but I think on this occasion the government is well-intentioned. I think it is trying to come up with a set of arrangements which provide sensible working hours for doctors and decent remuneration, but it will require a pattern of rostering and shift working in order to provide the full cover. That's particularly a hospital issue, but there are similar issues in making sure there is enough GP cover for enough hours of the day, enough days of the year, and where that can't be possible, then maybe a walking centre is an ancillary, which is another kind of GP service after all, because you end up at a walking centre seeing a GP that you can't see through the normal surgery. So the issue I think we've got before us rightly is, can health expansion in Wokingham keep pace with housing development? Well, it must do, and it's one of my jobs to try and chase and chivvy those who are planning these matters in the local authority and in the local health system to make sure they do. The work is mainly carried out again locally by a combination of the CCG and the local council. And one of the trends under this government is again to get councils more involved in healthcare, because we're very worried about the persistent gap. All my time as an MP so far, I've watched it and understood it, as have many of my colleagues. We haven't been able to crack it yet with any government. The gap between social care funded locally through the council and healthcare funded mainly by national grant through the NHS. And we're very aware that there needs to be smoother workings of the borders between the two. And one of the purposes of some of these devolution deals that other areas are now doing is to bring together the health budget and the social care budget so that people don't make the wrong decisions for budgetary reasons. You don't have people in hospital beds when they don't any longer need hospital care, but they need a proper package of social care, for example, because that can be a very expensive impediment to proper care and gets in the way of a better deal for both the patient and the taxpayer. Wokingham, I think, will not be wanting a devolution deal, but I'm very much of the view that we could still nonetheless make proposals that gave closer working between those budgets so that there was a smoother transition. Because if you go into one of our local hospitals, I think you'll be as aware as I am when I do that an awful lot of the beds are taken up by very frail and elderly patients with a range of different conditions which are problematic but don't always require day-by-day treatment in the hospital. And the issue is there some other type of provision, respite care, care home care, or a really good set of supporting measures for them to be in their own home, which could free some of those beds. And going more narrowly onto the issue of the adequacy of GP provision, the main funding system for GPs is based on the number of patients. So Wokingham will automatically attract more money as it invites more people in to live in the new houses. So there will be money. And if there isn't enough money, I'm always willing to take up the case, if it is a good case, as to how there can be more. The present government is reviewing the present method of funding GPs. Always hazardous, because they will have strong views as well. But I think the intention of the review is to make the funding even more related to the number of patients, and so that would be, all things being equal, helpful for us, because if we're going to have bigger growth in numbers, then obviously we need to have more money to tackle the task. There are currently consultations underway locally, I believe, and again this is something to talk to your councillors and your CCG about, concerning how the expansion of the GP service should take place. There are probably two routes. You can expand existing practices by hiring more doctors into the existing practices, or you can create new practices with entirely new premises. I think you're probably going to need a bit of both. Again, it's a matter for local determination and choice, whether you really like your current practices and want them to be bigger, or whether you'd like to have some new practices out there. We've had to already expand health facilities to cover Shinfield expansion, for example, and they're probably getting close to the point where we're going to need something more in Wokingham, because now there's quite a lot of house building going on in Wokingham. But as far as the government is concerned, they just want us to get on and make the provision, and the money will be following the patient and will be available. Locally, it's an issue of where councillors want the development of the health service to go, and where the CCG wishes to spend its budgets